Welcome back. We are joined by Dr. Dean Bright from Bright Foot Clinic. We're going to talk about a new procedure if you're experiencing pain in your feet. Ooh. Hey, Dr. Bright.
Hi, how are y'all?
Yeah, doing great. Good. Now, one thing if people are experiencing pain that they're going to be familiar with are bunions. Tell us what those are.
So bunions are actually a deformity of the big toe joint, and they're caused from a unstable joint kind of at the base of the first metatarsal, or kind of the midfoot area. And that instability at that joint allows a deviation of the great toe. And that deviation on the great toe will then not only lead to the bump on the side of the foot of the big toe joint, but it will also eventually start causing stress to the cartilage and therefore related joint pain.
I've never heard it called the great toe. Is it that's the big toe, right?
Big toe, first toe, great toe.
Okay. Calling it great toe from now on.
Now, if someone is experiencing pain and they've got bunions, what are some options that are out there for treatment?
Well, so most of the initial evaluation is going to consist of working the patient up, x-ray examination. Obviously, most pediatric surgeons will try some conservative treatments first, change of shoe gear, orthotics, padding. And if that conservative treatment then fails to render the relief to the patient, then surgical options will be considered.
Okay. And you have a model right here.
Correct. Yeah, so this is the model of the, actually the Lapiplasty correction. So the bunion deformity basically is this is the first metatarsal, and once this deformity starts, it will deviate out towards the arch side of the foot. The resultant two bones in the toe will then go in the opposite direction, and you'll get the bump on this outer side. And so the alignment of the Lapiplasty procedure addresses this unstable joint back at the base, or what's called the core of the deformity, and therefore stabilizing the whole bone and realigning it parallel to the second. Previous bunion corrections were addressing a two-dimensional deformity where they would just shave the bump and make a cut up here at the neck. But with the instability back at the base of the metatarsal, the Lapiplasty has now addressed this correction in a three-dimensional correction for both side plane, up and down plane, and rotational plane.
Yeah, absolutely.
Well, that leads right into the next question. I mean, Lapiplasty is kind of a new surgical procedure, right? But what kind of results are you seeing from folks who have this done?
Yeah, so it was FDA cleared in 2015. My personal experience, I've been performing the procedure since 2018. I've done over 200 of these.
Wow.
And my patients basically are seeing a much quicker return to weight bearing. Typically the procedure is an outpatient procedure. Takes about an hour and a half to perform. They go home same day. My patients will basically be non-weight bearing for about 3 to 5 days. Get them through that initial kind of pain phase, and then I'll let them start bearing weight in the boot, in a walking boot, and they can be direct weight bearing in that walking boot within 5 days. They're in that boot a total of 6 to 8 weeks, depending on healing time, and then they can progress back to regular shoe gear and really start getting back into regular daily activities. Most of that will return by the 10th to 12th week. They're back to full activities.
Wow. Okay. Seems like a pretty quick recovery time for
that. Much better than what it has been in the past.
Yeah, so if you want to contact the professionals, Dr. Bright, you want to find more information, we're going to have all of that for you over on our website, so make sure you check that out. You can see it right there on the screen as well. Schedule an appointment if you've got bunions or you have any kind of foot pain. They're the folks to go see. Thanks so much for joining us.
Thank you very much for having me.
Yeah, for sure. Yeah. Stay with us. We got more Good Day NWA coming up right after this.
That is a very cool model.
Yeah, isn't it though?
Yeah.